Hi, Katie. How are you doing today?
I'm okay. I'm here just because I've been having some stomach pain and headaches.
Stomach pain? Okay.
Yeah.
And before we get into it, I'm just going to ask you to verify your first and last name and your date of birth.
Sure. Katie ASMR. And it's March 24th, 1988.
Okay, great. Now, tell me a little bit about the stomach pain and the headaches you've been experiencing. When did these first start?
Sure. So, the stomach pain has been going on for about a month.
A month?
Yeah. And it's just at random times throughout the day, I'll just all of a sudden feel this, achiness in my stomach. And honestly, I cannot tell whether it's like my stomach muscles or digestion or what's going on. It's just very, very tender.
Okay. Does it have your bowel movements been affected at all?
I can't say that they have.
Okay.
No.
Is it tender when you press on it at all?
Very tender.
Okay.
Yeah.
In the last month, have you had your period? Does the period pain affect that at all?
Period pain always affects it, but that's been since I first got my period. But it definitely exacerbates the pain that's already there.
Gotcha.
Yeah.
And tell me a little bit about the headaches.
So that started more recently. That started in the last 2 weeks.
2 weeks?
Yeah, and it'll happen in the afternoon, weirdly enough. It'll just be like this pounding headache, and I never get migraines. It's not something that is, doesn't run in my family. I've never had it before, so I'm worried about that.
Okay. Have you been getting adequate sleep at night?
Sometimes I have insomnia, yeah.
Okay.
Mm-hmm.
Do you consume caffeine regularly?
I do.
Gotcha. Is it coffee or just sodas, tea?
Coffee, a couple cups a day.
Gotcha.
Yeah.
Okay. So I think today, Katie, we're going to do our exam in 2 different parts. We're going to do a cranial nerve exam to try and discover more about those headaches that have been troubling us. And we're also going to do an abdominal exam to take a look at that stomach pain you mentioned.
Thank you so much.
My pleasure. You can just go ahead and relax. I'm going to go ahead and start off by taking your blood pressure and listening to your heart.
Thank you.
All right. Is this arm okay for our blood pressure test? I'm just let this in your lap for just a moment. Okay, I'm going to have you relax your arm. I'm going to take this from you. Okay. Our blood pressure today is 120/80, so it's going to be a normal reading for today. I'm just going to go ahead and slip this off over your arm. Now I'm going to go ahead and check your oxygenation. I'm going to go ahead and put your finger right in there, as well as listen to your heart. Go ahead and relax. Just going to gently move your hair. Okay, now take a deep breath in and exhale. Good. Now a deep breath in and exhale. Great. Everyone's listening on your back. Big breath in and exhale. Great. So Katie, your heart is beating strong and healthy, which is always a great sign. And your lungs are definitely clear, free from any obstructions. Oxygenation at room temperature is looking perfectly normal. Okay, take this off. I'm going to go ahead and start our cranial nerve exam now that we've gone ahead and checked the vitals. I'm just going to put on my gloves and then we can begin. Okay, Katie, first I'm going to go ahead and just take a look at your hair, feeling the scalp. Go ahead and bend your head forward. Okay, I'm just going to begin to gently feel the scalp. Make sure there's no underlying bumps or lesions hidden in our hairline. Does touching your head give you any pain?
No, it's mostly internal.
Gotcha. Okay, the scalp is looking healthy. No signs of any dandruff. No signs of any lumps or lesions. I'm going to ask you to put your head in upright position once more. Great. You can go ahead and close your eyes. I'm just going to begin by gently palpating the skin of the face. Massaging along the line of the temples. This can definitely be a cause or a built-up area for migraines, so it's always nice to gently massage this area to relieve a bit of tension. Just feel the jawline as well. Feel our lymph nodes. I don't feel any excessive swelling. Does anything on your face hurt to touch?
I feel a lot of pressure here. That's kind of where the headache pain comes from.
Okay.
Yeah.
Just gonna gently massage. I'm not feeling any kind of outward symptoms of those headaches, which is a good sign. No obvious signs of head trauma. Okay, you can go ahead and open your eyes now. We're just going to go ahead and begin to eliminate some of the other things, the possibilities of what could be bothering your headaches. First, I'm going to go ahead and take a look inside your ears.
Sure.
Okay, go ahead and relax. Okay, everything is looking healthy inside of your left ear. No symptoms of any drainage or discharge. No redness or irritation. Everything looks healthy. Great. Everything in this ear exactly mirrors the other. No excessive wax or redness or discharge. Have you noticed any problems with your hearing lately?
Not really.
Okay. Sometimes migraines can cause tension around the skull, which can sometimes lead to some hearing troubles. So I'm just going to go ahead and use my tuning fork to conduct a brief hearing test.
Okay.
If you wouldn't mind just facing straight ahead. Okay, go ahead and close your eyes for me, Katie. I'm going to play 2 sounds for you, labeled position 1 and position 2. You're going to go ahead and tell me which position sounds loudest in your ear.
Okay.
Position 1, position 2.
2.
Great. Position 1, position 2.
1.
Position 1, position 2.
2.
Position 1, position 2.
1.
Great. Go ahead and keep your eyes closed. I want you to tell me on which side you hear this sound, left or right or both.
Okay. Left. Right. Both. Right. Left. Left. Right. Both. Right. Left. Both.
Great. Now I'm going to take a look inside your nose. If you wouldn't mind turning your head towards me just a slight bit. If you wouldn't mind tilting your head back. Okay, lovely. The tissue is looking nice and pink and healthy. No signs of any drainage or discharge or swelling. And take a look inside your other nostril. Great. Everything is looking healthy. Have you noticed any problems with your sense of smell lately?
I've never had a great sense of smell.
Okay.
I've noticed that lately it's kind of like even more dull
Okay.
than usual. Yeah.
Gotcha. We're going to go ahead and just test that out real quick. If you wouldn't mind closing your eyes. I'm going to gently just spray this scent oil on my hand. I'm going to hold it up to you and tell you to inhale. You're going to tell me what it is that you smell.
Okay.
And inhale. What is it that you smell?
Cherries.
Yep.
Yeah.
Now I have a little vial of scented oil. I'm just going to hold it up to you. Let me know what it is that you smell. And inhale.
Yeah. Like something musky, like myrrh or something.
You know, it's a more floral scent.
Oh,
so
gosh.
we are gonna try one more. Go ahead and close your eyes. And inhale.
I couldn't smell that at all.
Okay.
Yeah.
This is a pretty strong orange scent. So I'm going to go ahead and make a note of that in your chart.
Okay.
Hopefully that doesn't lead to any further problems, but we are definitely going to be looking into that as we move forward.
Okay.
For now, we're going to go ahead and move on to your mouth.
Okay.
Katie, go ahead and stick out your tongue for me as far as you can and say, ah. Great. Everything is looking healthy inside the mouth. No signs of any ulcers, any signs of infection. How is your sense of taste?
It's a little not so great lately. Yeah.
Okay. Okay, Katie, I do have some edible oil here today that I'm just going to go ahead and drop onto your tongue. Go ahead and open wide and tell me what it is that you taste. I'm going to open a little bit wider for me. There.
Cherries.
Okay, this is more of an orange flavor, but definitely part of the fruit world.
Okay. That wasn't too far off.
I'm going to go ahead and try another one with you.
Okay.
Open a little wider, and there we go.
Cinnamon.
Yep. And one more, just to even it out. Gonna be open a tiny bit wider, and there we go.
That was very salty, like vinegary.
Yeah.
Yeah.
Yep. Okay, great. Okay, Katie, lastly, as part of our cranial nerve exam, we are going to be taking a look at your sense of sight. I would like you to go ahead and raise your right hand, go ahead and hold this chart, and cover your left eye with your free hand. Will you read me this row starting from the left and moving toward the right?
OLCF.
Okay, great. Will you read me the second to last row starting at the right and moving towards the left?
JHDFC.
Lovely. And what letter is this?
E.
And read for me the bottom row starting at the left and moving towards the right.
LTF. PH.
Great. And what color is this?
Red.
And which color is this?
Brown.
Okay. Now I'd like for you to go ahead and switch hands, as well as switch eyes. Okay. What are these two letters?
LT.
Okay. Go ahead and read for me this row starting at the right and moving towards the left.
FCLO.
Great. Go ahead and read this bottom row for me starting at the right and moving towards the left.
HPFTL.
Great. Go ahead and read this row for me starting at the left, moving towards the right.
DHJBS.
Lovely. And what color is this?
Red.
And what color is this?
Green.
Okay. Now, in our other eye, we saw this color is brown, which is something we're going to want to look into. Have you been to an optometrist recently?
No, it's been a while.
Okay. That is likely not a major health concern, but I am going to go ahead and recommend that you do go to the optometrist sometime in the very near future.
Okay.
Just to have that checked out. Now go ahead and face me. Go ahead and follow my fingertips with your eyes, but not your head.
Okay.
Okay, now go ahead and stare straight forward. Let me know when my fingers come into your peripheral vision.
Now. Now.
Okay.
Now.
Okay, great. Now I'm just going to go ahead and feel some of the muscles in your face. Go ahead and raise your eyebrows. I'm going to go try and push them down. Don't let me do that. Okay, lovely. I'm going to go ahead and place my hand here. Try and turn your head to the right. Okay, great. Now go ahead and put your arms out for me. I'm going to try and lower your hands. Don't let me do that. Great. I'm going to push them up. Don't let me do that. Okay, lovely. Now you can go ahead and relax. Shrug your shoulders for me. Great. Go ahead and look in my eyes. Smile for me. and frown. Okay.
Okay.
How is your head feeling right now?
Well, it's like getting a little past noon now, so it is starting to throb.
Okay, I gotcha.
Yeah.
We are going to go ahead and conduct some more tests on you after this, but we are going to go ahead and move along to the abdominal exam for the time being.
Sure.
Okay. You can go ahead and lay down on the table, and I'm going to go ahead and take a look.
Okay.
Okay, Katie, I'm going to gently lift up bottom of your turtleneck here and lower your pants just a tiny bit as far as is comfortable for you. First, I'm going to begin by just palpating the stomach. Let me know if anything causes you too much pain or discomfort, and I will ease the pressure. I do feel a bit of inflammation in the stomach right away.
Yeah.
Go ahead and listen. My stethoscope here. This might be a bit cold on your skin.
It's okay.
Okay. I'm only hearing standard digestive noises, which is a good sign. Which does indicate that this isn't a digestive issue, but in one of our other stomach organs.
Okay.
Just to go ahead and, so we can rule things out, I'm going to go ahead and conduct a warm or cold test. I'm going to go ahead and press a cold object into your skin, and then the warmth of my hand. I want you to let me know which it is that you feel.
Okay.
Okay, this is an example of what warm is going to feel like, and this is an example of what cold is going to feel like.
Okay.
Can you tell the difference between those two sensations?
Yes. Cold. Cold. Warm. 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 Cold. 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 Warm. Warm. Cold. Cold. Cold.
Okay. Now I'm going to move on to a sharp or dull test. Same idea, except you're going to be differentiating between sharp or dull. This is going to be what dull will feel like. This is going to be what sharp will feel like.
Okay.
Do you notice the difference between those?
Barely.
Okay. We can go ahead and move to a slightly sharper object. This is our dull. This is our sharp. Do you notice the difference more there?
Yes.
Great.
Dull. Sharp. Sharp. Dull. Sharp. Dull. 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 Sharp. Dull. 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 Sharp. 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 Dull. Dull.
Okay. We had a little bit of issue differentiating between the sharp and the dull at one point, leaning more towards dull. I'm going to go ahead and do some measurements of your stomach just to feel for the inflammation.
Okay.
Go ahead and relax.
Okay.
Sorry, since you're not talking anymore, just gonna get the guy over here. Gently feel the internal structure and do some measurements based off of the touch. Okay, Katie, so further testing is going to need to be done on the stomach. From what I can feel, it doesn't feel like the issue is too far beneath the skin, however, likely in the intestinal system. I am going to help relieve your symptoms, though. We're going to go ahead and schedule you again tomorrow to do some further testing, but for now, you can go ahead and relax. I'm just going to go ahead and soothe the areas so we can ease your pain until we can take a look at you tomorrow. Okay, first I'm going to go ahead and place some hot stones on your abdomen. been soaking in steaming water. I'm just going to give them a little bit of a try. Set them on the stomach. Is that too hot? No, it feels really good. Great. Let me know if any of these stones are too hot. These stones have been infused with hot tea water to help calm the stomach. To help put a bit of weight onto the area of inflammation. Gently remove the stones on the left side of your body. And I'm going to gently drop some rosemary oil onto the stomach. And I know that the smell of this rosemary is pretty strong, lovely but strong, so let me know if this triggers your migraines in any way. I'm going to this side. Okay. And just to make sure that that rosemary oil does really absorb into the skin, I have a tiny brush with me. Katie. Just going to gently cover your stomach back up. So like I said, we are going to go ahead and meet again tomorrow if you're available to conduct some more tests.
Yeah.
Okay, lovely. We definitely learned a lot today that's going on with you. We're going to further look into your sense of smell as well as taste. We're going to do some more, an MRI of your skull. Definitely going to look more into your stomach as well. I think it was very beneficial that you came in today, though, and I look forward to help figuring out what's going on with you.
Thank you. The stones felt amazing. So
Yay!
It already feels a little better.
Okay, I'm glad to help relieve your pain until tomorrow.
Thank you.
Thank you so much. I'll see you again soon, Katie.
See you.
Bye-bye.
Bye.